Would you just mind contrasting REM sleep with non-REM deep sleep, which we call delta? Could you just tell them the differences, because that difference is really striking?
It is. The two states between non-REM and REM sleep are as different in some ways as awake is from sleep. REM sleep is the stage of sleep that we do almost all of our dreaming in. And REM sleep tends to predominate in the second half of the night. And if you think in your own experience, you've done most of your dreaming in the latter part of the sleep period.
Just before you wake up.
Generally so. That last couple of hours is when you have much more intense dreaming, and that's because REM sleep predominates in that portion of the night. Non-REM sleep predominates more in the first half of the night. And so, you know, again, what is happening with many of the non-REM parasomnias is that, for reasons we don't fully understand, there is this partial arousal phenomena where the individual may show some features suggestive of wakefulness. For example, the eyes may be open. The individual may be up ambulating, but they are not truly awake. They have some very low-level processing. For example, they might be able to go up or down stairs.
They look like they're making sense when they're out and about doing these things in the middle of their sleep.
That's right.
Which can be confusing for the people watching them. But this is the way I heard it, and that is during the deep sleep that is not REM, that the mind is completely shut down, more or less, resting, and the body is awake. So that's why when that partial arousal comes and there's a signal to do something, the body is ready to go. Am I on the right track?
Generally.
And then so do the flip side of REM, because it's just the opposite.
Well, in REM sleep, this is a very active state from a psychological standpoint. Dreaming, processing, things like that. And in the normal situation, the individual's muscle tone is very low during REM sleep.
Near paralysis, but not paralysis.
That's right. It's sort of like a temporary paralysis, and that's just normal REM sleep. That's a protective mechanism in many ways. In fact, there is a specific type of REM parasomnia that we may get to later called REM sleep behavior disorder.
Exactly.
A rather fascinating sleep disorder.
Oh, we're going there. Okay, well, what makes the arousals that occur during parasomnia or sleepwalking, sleep talking, different from just the normal arousals? And also, describe how we're using the word arousals, because people think they're either awake or asleep. But arousal is a sort of expanded term.
That's correct. The term arousal in the sleep field means that there is a temporary shift from a deeper stage of sleep to a much lighter stage of sleep. And the brain organizes and orchestrates what state we are in. And so it is quite normal to have recurrent periods of brief arousal, lightening of sleep, or even brief periods of awakening. If the period of awakening is brief, for example, 30 to 60 seconds, we may not even remember that we woke up.
Right.
It generally takes a couple or 3 minutes of wakefulness before we consciously remember that the next day. But even in the normal situation, we are having these transient arousals or even brief awakenings during the night. But what's different with a parasomnia is that these individuals get, in essence, hung up on that transition. They stay in that partial arousal for seconds to minutes. And so I use the expression, it's sort of a southern expression, but they are stuck betwixt and between.
That's it.
They are not fully awake, but they are not fully asleep.
Right.
Most of the brain physiologically is asleep, but there is some selective activation of a few areas of the brain.
And just to see someone go through this, I have got to ask you, if you're a person that has parasomnia at nighttime, if you take a 2 to 3 hour nap during the day, can you experience parasomnia then?
You certainly could. It is much less likely that the parasomnias will manifest during daytime naps, but they can occur, and that's particularly true with younger children who, during a nice 2 or 3 hour nap during the day, they are quite likely to go into deep non-REM sleep. One interesting thing to mention about that deep non-REM sleep, especially in toddlers and preschoolers, that is a very intense deep sleep. And the child may not wake up when you pick them up, move them from, say, a chair to a bed, or put them in a car seat, or pick them up and change their clothes, or things like that. And they are very deeply asleep.
I've actually seen a preschooler in a stage 3 incident, and it just made me a nervous wreck, and I didn't know what it was at the time, but I know now. Okay, nightmares and night terrors to people are the same thing. They either assume that the terror is a nightmare or vice versa, but they're very distinct things. Could you kind of give us the contrast there?
Well, I'd be happy to. And the names do sound very similar, but they are completely different phenomena in terms of sleep, and they occur at different phases in the sleep period. Right. And so I do have a small diagram that will help me in describing the difference. We basically live our lives in one of 3 states, as I was mentioning earlier. We're either awake, or we're in non-REM sleep, or we're in REM sleep. And so these are the 3 states. And in the normal, usual situation, we're in one and only one state at a time. But, for example, with night terrors, one of the non-REM parasomnias, the individual is in non-REM sleep, but then has some features of wakefulness. And so it's right here at this interface between awake and non-REM sleep. Night terrors occur mainly in children, but can occur in adults. And they're characterized by a very loud, blood-curdling scream or yell. The individual has a look of utter panic on their face. They are very agitated. They often have racing heartbeat. They may look flushed or have a pale expression. They're breathing hard. A lot of activation physiologically. They do not respond to efforts to bring them out of this. In fact,
scares parents to death.
Exactly. And trying to stimulate the child by shaking them, calling their name, or putting a wet cloth on their face may actually serve to prolong the duration of the event. But again, the individual is at the interface between wake and non-REM sleep. Night terrors can last on the order of 30 seconds to 10 or 15 minutes. Now, in contrast with that are nightmares. Nightmares occur out of REM, or rapid eye movement sleep. And so again, they're going to tend to occur in the second half of the night. And the individual may have a few features of wakefulness. Interestingly, with nightmares, the individual does tend to remember the content of the nightmare much more vividly.
Whereas in the terror, the little individual does not really remember what's been happening, even though they've been very active and very loud.
Correct.
Okay.
They may have little or no recollection. Nightmares tend to be more recalled by the individual. They tend to occur in the second half of the sleep period. They can be associated with some activation, racing heart, heartbeat, maybe breathing a little bit faster, but they're not nearly as physiologically activated as the individual is with night terrors.
So it is a whole different thing, and that's what I really want parents watching to know. Don't try to get those confused, and don't become unduly upset when you can't rouse them, because you just need to make sure that they're not hurting themselves or anyone else, and kind of waiting it out so that you can comfort them back to sleep.
That's correct, and I have to add that in a number of cases, especially for newer parents who may not be familiar with what night terrors are, because they are so frightening, the parents sometimes wonder if the child is in pain. They may even wonder if the child is having a seizure.
Yes.
And so these are scary events, and parents have been known to pick the child up and head to the emergency room.
Well, I think a better thing might be just to make an appointment with your pediatric neurologist sleep specialist the next day.
That would be another option.
Yes, it sure would.